Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
So let's talk about the overview of a GLP-1. And a GLP-1 is called glucagon-like peptide -1, and it's a hormone that plays a crucial role in our overall blood sugar regulation, appetite control, digestion, and metabolism. It is a acting like hormone that has gained significant attention recently in metabolic health, weight loss, and diabetes management. Due to this ability, it helps with enhancing insulin secretion, suppressing glucagon, and promoting satiety, which is your appetite suppression, so that way you're not wanting to eat as much. Research has highlighted this GLP-1 receptor agonist medications mimic hormones. So it is not a hormone, but it will uptick the insulin hormone to release, so there's less insulin resistance within the body and other things. It helps with type 2 diabetes, obesity, and a range of issues in the body. So anything from cardiac issues to addiction issues, overall liver, fatty liver, and many more, which we can go over. And there are ways that you can enhance this GLP-1 markers naturally with dietary, lifestyle, and gut health strategies, which we will go over. And understanding this is really important. It is why, America and the society has been significantly around 85 to 90% obese, overweight, or having some sort of internal issues. It matters. It totally, totally matters. So if you want to make change, and that's why you're here, right? That's why you want to know more. So what is a GLP-1? GLP-1 is a hormone, an incretin hormone produced by L cells in the small intestines. So that's our body is naturally producing a GLP-1. These medications are peptides to produce to be like this GLP-1. And in response, it's for food intake. So it's a messenger, it goes to the gut, pancreas, the brain, and other organs to regulate blood sugar, appetite, and digestion. When it's off, or some part, the gut, the pancreas, brain, or other organs are off, your GLP-1 will be off. When you have, most of the time, it's insulin resistance or obesity, those will change. Functions of GLP-1s, they enhance insulin secretion. So when it's at a really good level, you're helping lower blood sugar levels for meals. When it suppresses glucagon, which prevents unnecessary glucose from releasing from the liver. If you have too much sugar, and the liver is not doing its job, it will help suppress that, or at least balance it wherever it needs. It slows gastric emptying, which you'll notice when people will get constipation issues. That's its job. It's trying to keep some things staying in the stomach so you're fuller. Now, you want to combat that in some aspects is you still want to eat. So we'll talk more about foods and nutrition for these medications. Now, your cravings, obviously, it does have a satiety, so suppressing the appetite. It does reduce your food cravings, your calorie intake. And then it supports the gut microbiome because it helps with regulating the amount of bacteria and regulating metabolism. So you want to have like a less dysbiosis, which dysbiosis is the irregularity of the amount, so the good and bad flora within the body. So you want to kind of prevent that. And how do we do that? We want to regulate this with the GLP-1. So the reason why these have been around since the 1980s, but the way the research and the way that these peptides have been redone and patented is quite phenomenal. And the changes that has come out, the research had just been published, since the 80s, and then now there's numerous things about the blood sugar control and weight management that GLP-1s have on the body. Now, what's this role, and how does this affect GLP-1 with your metabolic health? Metabolic health is defined as stable blood sugar, balancing your hormones, efficient digestion, and optimal energy levels. How do you do that? This is all by blood sugar regulation. You do that by stimulating insulin, releasing when your glucose levels are high. You reduce glucagon secretion by preventing excess glucose release. You enhance insulin sensitivity by lowering the risk of insulin resistance and diabetes. Why does it matter? Chronic high blood pressure levels or hyperinsulinemia lead to insulin resistance. This is what's wrong with most of society. Not everybody has type 2 diabetes, but everybody has a lot of high doses of hyperinsulin, which then will lead to many chronic illness. And until you combat that, you will not be able to make change. Mostly type 2 diabetes, obesity, metabolic syndrome. GLP-1 helps post-meal glucose spikes and promotes long-term glycemic control. Again, why is it important? Appetite and weight management. So with appetite and weight management, increase satiate hormones, which is appetite suppression, and reduces hunger and food cravings. It slows down digestion, reducing your overeating and your snacking, which then would reduce your calories. That does not mean that you don't eat. It just means that we want to see what you're putting into your body and what you're making. Encourages fat loss without muscle breakdown. It does do this, especially if you have the right amount of protein, and we'll talk about that at another part of this lecture. Why does it matter? When you have low GLP-1 levels, you tend to have increased hunger. You tend to have more cravings. You tend to have difficulty losing weight. Boosting GLP-1 naturally through medications can improve this weight loss success. The medication is a tool. They're not the full equation, but it has been very helpful. There is some other changes that happen in your hormones as women and men age. The research does show that GLP-1 agonists and semaglutide and tirzepatide do help with lowering that daily calorie intake. And it's just a matter of what you're putting into your body. So it's not a one size fits all. Now, in reference to gut health and the microbiome, I'm very big on trying to talk about having a balance of dysbiosis. So not to have dysbiosis, which means irregularity of the good and bad, but trying to bring in the good things. So you're going to stimulate growth of your gut bacteria, say Akkermansia, which is a very weight management probiotic in the gut, and it's usually in the colon. Increase short chain fatty acids production, which supports metabolism. That's what you put, those fibrous foods into your body. That's what you put to help get rid of some of that excess. Reduce inflammation and gut permeability, leaky gut syndrome. So leaky gut has to do with when the lining from the mouth all the way down to the anus in some manner has some sort of irregularity, or the junctions are starting to kind of pull apart. Usually it's in the stomach, that's where it starts, or in the small intestines. Why does the gut matter? Why is it so important? Because it is so critical in medical health, metabolic health. It is so critical in our health in general. It is important to have good gut health is the second immune system. Poor gut health reduces GLP secretion and many other things, slows metabolism, causes weight gain, cortisol issues, other health issues. And the research does show that when you have more rich fiber, it does enhance your GLP-1. So when individuals ask me which GLP-1s or what probiotics to use, I'm usually a fan of certain gut health ones like Akkermansia or some, depending upon the need of that patient or that client. And how is it effective for those with type 2 diabetes? It helps those with type 2 diabetes or those preventing, those may be in metabolic syndrome that would like to prevent diabetes. How does it do that? It does that by lowering the sugar. It reduces insulin resistance. It protects the beta cells of the pancreas. And it helps those pre-diabetic patients not become diabetic. It helps in many aspects in the liver, lowering the A1C, and it reduces it. So initially, these were used just for diabetic patients and now used for weight management and other health issues. So they do work. GLP-1s work because they mimic the natural hormone. Now, these medications work because they mimic the natural hormone for real. And they have been around since the 1980s. But newer medications like semaglutide and tirzepatide are the most used and the most effective. But there is also lutritide, Trulicity. There's many others, and we can go over that if you have additional questions. What is the effect of the GLP-1 medications? It obviously affects the blood sugar very strongly. If you had a natural boosting supplement, it will help moderately, like berberine. Weight loss management is very significant. If you're doing just nutrition and lifestyle, it's gradual, but if you do them together, they're very helpful. And the side effects, obviously, most clients have nausea, GI symptoms, and constipation. And long-term solutions is you may be medication dependent, or you might need microdosing, or you might have to fluctuate on and off depending upon how your lifestyle and management is. And that is debatable. But like I said, it's a not the full fix. So natural ways are GLP boosting. One is you're going to boost it with more fiber, always more fiber. Include protein and healthy fats, like eggs, nuts, and olive oil. Exercise regularly, that depends upon the patient. Strength training, aerobic exercise, walking, and such. And managing your stress and your sleep is so important. So 7 to 8 hours of sleep is recommended for each person, and managing your stress daily in wherever that is for you, and learning techniques to do that between breathing, cortisol imbalances, and stress management. And I can go over that at some other time if you need additional resources. And making simple dietary and lifestyle management changes can boost your body's natural GLP-1. So imagine you take these medications, you're also trying to boost your own GLP-1, and you're getting to this perfect kind of symbiotic relationship, and using those medications to be the best version of yourself. And I can tell you, it works. And it gives you weight loss, appetite suppression, good health. Your hormones start to become optimized and balanced. Your blood sugar levels become more controlled. You become kind of like a powerhouse. The GLP-1 medications are, big now because they are working. And if you know what you need, it's pretty great. And there's going to be some worksheets and some extra quiz there. So make sure you reach out. And if you have any additional questions, please let me know. Thanks so much.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not the substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.